Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question in this series of questions from my client Robert. And the question last week was part 6 of my 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from my client Robert, which are excerpts from email counseling and consulting sessions with me. And the question this week is part 7 of my 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? So Robert continues with his mother's situation. And he writes, Hi Patrick, the tracheostomy went well today. The doctors decided not to do the PEG at this time. She was having a hard time finding a clear line in which to do the PEG. They will revisit doing the PEG in a few days. Right now, all vital signs are stable. She was showing more eye movement last night than we have seen for a while. Not all the way open and not making eye contact or focusing, but at least it's unprompted. They've done an ultrasound to check for gallbladder issues. I understand that's common. And they have also done an EEG. So for now, we're back to our 3 Ps. Patience, persistence, and positivity. Many thanks from Robert. So here is my response. Hi Rob, thanks for the update. I'm glad the tracheostomy went well. It'll be way more comfortable now for your mother to tolerate the ventilator because she will need less sedation. I don't see the need for a PEG tube at this stage. A nasogastric tube can feed her just as well, and there is no need for another surgical procedure. I do believe that PEGs are only necessary for patients who will not be able to eat again for a very long time to come. We don't know what's going to happen with your mum at this stage, but it's way too early to say which way she's going. There is no need for a PEG at this stage. So here's Rob's response. He writes, Hi Patrick, it's still been a roller coaster for a few days. My mum had to be taken in for surgery yesterday. The CT scan revealed some air in her abdomen, and it was more than they had seen there before. The doctor that conducted her first operation was also available for this one. What they found is that parts of her smaller intestine had been damaged, almost dead with some blood clots. They ended up removing 85 centimeters of it, leaving about 100 centimeters after restitching. The operation went well. The doctor indicated that her intestine issues may have been contributing to her mental status and was hopeful that now that we had resolved that, there was a chance we would start seeing some improvement. That evening, a few hours after the surgery, when we went to see her, she had her eyes open for several minutes. This was a much better response than we had seen in the previous week. My brother asked her a question, whether she can see us or recognize us, and she blinked in response to that. It could have been a coincidence, but it didn't seem that way. There were 3 members of the family there to witness it, including myself. We couldn't get subsequent responses, but her eyes did remain open. Now the bad news is that yesterday she took a turn for the worse. She's still fighting the infection in several areas. The antibiotics she's on are about the most powerful they have available. The most recent one they added evidently takes a high-level approval. The ICU nurse said that in her 26 years of practice, she had never seen anyone actually given that antibiotic. I will have to find out the name, but I think it's Primaxin. In any case, yesterday they started seeing some issues with her kidney function. They use some numbers to measure the degree of non-functioning. It was 1.2 when things were going pretty well, but it had risen to 1.8, the higher being worse. The doctor said in the 6 to 7 range is when they get really worried, and 9 to 10 is when they consider dialysis. Thankfully, we're not there yet, but that's not a good sign. Her breathing already deteriorated, and she's now 100% on oxygen and breathing through the ventilator. We're thankful that the tracheostomy is already done, so getting her back on the ventilator was not an issue. The blood pressure meds have been staying relatively low at around 3. The highest yesterday was 8 mils an hour. She has no fever at all, and white blood cell count is around 15,000. The urine production is lower and a little cloudy. They have sent it in for analysis. Basically, it sounds like she's fighting multiple infections, but they've given her all the antibiotics they can and also an antifungal medication. My brother is at the hospital now and will be listening in on the doctor's rounds, as we have been doing, and talking to the doctors. I'll get an update within an hour or so. Meanwhile, if you have any feedback or thoughts, I would love to hear them. Thanks, from Robert. So here is my response. Hi Rob, thank you for your update. I'm really sorry to hear that things are not going well. Here are my thoughts on the situation from what you have shared up to this point. Whenever abdominal surgery is performed, which was the case when they stitched the perforated stomach, there is a risk that other parts of the abdomen do get harmed, i.e. small intestine blood clot with dead bowel tissue. I assume she must have had some sort of mesenteric infarct, which makes me ask 2 questions. Number 1, have they anticoagulated her sufficiently? Anticoagulation meaning blood-thinning medications such as heparin or clexane, also known as enoxaparin, which is imperative in most critically ill patients. And number 2, have they started to feed her early? I presume they must have, because you mentioned early in our email communications that she had the feeds and nutrition going via the nasogastric tube. Also, do you know if they've done a stoma or closed the abdomen? It's good that she hasn't got a peg. They might have ended up removing the peg during the surgery anyway. I also assume that contributing to all of the abdominal issues would be not having open bowels for several days, making it all the more likely to end up with blood clots, as well as putting pressure onto the lungs, making breathing more difficult. Not opening bowels for several days, as well as having had previous abdominal surgery, also often contributes to accumulating air in the abdomen. There is also a very good chance that the intestine issue contributed to your mother's mental status, and it most likely didn't help your mother waking up. It's very encouraging to hear that your mother had her eyes open for several minutes, making eye contact and responding to simple questions. The sources of infection appear to be in her gut and the lungs, especially with being 100% of oxygen. The antibiotic Primaxin is usually being given for Pseudomonas infection in the lungs. You may want to ask the doctors if she's got Pseudomonas in the lungs. A Pseudomonas infection in the lungs is not all that uncommon in ICU, but it's certainly nasty. Another antibiotic commonly used for Pseudomonas is tacecine or piperacillin. The white cell count at 15,000 is confirming that she's fighting infections. It's also a sign that the immune system is working. It's perfect indeed now that she's got the tracheostomy. There is no way to do a tracheostomy on 100% of oxygen, as it would be way too risky. It would be good to know why she is 100% of oxygen now. Besides pressure from the abdomen restricting her lung capacity and the Pseudomonas infection, what else is going on in the lungs? I hope she's not going into lung failure or ARDS. It would be great if you can ask them for results of the chest X-ray. Also, are they considering a CT of the chest? Also, with oxygen levels at 100% for now, what's their plan? Are they adding on something else to the therapy? For example, nitric oxide comes to mind. I'm not surprised that kidneys are slowly starting to deteriorate. It's often a catch-22 in intensive care patients with severe infections and all the antibiotics and antifungal medications. Some side effects of antibiotics are to impair kidney function. On top of that, your mother would have most likely had periods of lowish blood pressure throughout her ICU stay, resulting in not giving her kidneys enough perfusion, adding on to the kidneys slowly deteriorating and going into acute renal failure. The kidneys are usually the first organ that's failing in critical illness after the lungs, when patients are ventilated in particular. The kidneys are also the organ most likely to bounce back, even after hemodialysis therapy. In terms of kidney blood markers and kidney blood results, they are referring to urea, and normal urea levels are 2.5 to 7.1 millimoles per liter. Therefore, it makes sense to look at dialysis greater than 9 millimole per liter. If it's currently 1.8, I see no reason for concern yet, and I would also be interested in her creatinine blood level, which is another kidney marker. It's very likely that they will try and increase urine output with medications such as furosemide or Lasix first. Especially with breathing on 100% oxygen, it's going to be important to keep the lungs dry, so to speak, making sure there is no excess fluids in the lungs. Generally speaking, in critically ill patients, it's very important to maintain a healthy fluid balance that's of benefit for a critically ill patient. Most of the times, it's a negative fluid balance, especially in light of mechanical ventilation and wanting to keep the lungs dry to reduce oxygen requirements. If diuretics like furosemide or Lasix don't work and kidney markers keep going up, a logical next step would be hemodialysis. Overall, Rob, I'm certainly worried about the new developments, and going back for surgery during critical illness is not a good sign, but it's what it is. And again, sticking with your 3 Ps, patience, positivity and persistence, is still a wise approach from my perspective. To give you some perspective, we have been working with the client since the end of November last year, the 61-year-old gentleman who came to ICU after perforated bowels and severe abdominal sepsis. He was ventilated, high doses of inotropes or vasopressors. He had a tracheostomy and he was on up to 80% of oxygen on the ventilator. When we first started working with the family, they initially hired us because the ICU team wanted to withdraw treatment against the will of the family. Cutting a very long story short, after nearly 2 months and many conversations with family, the doctors and the nurses, and after encountering much resistance from the intensive care team, the gentleman has left ICU alive last week and is now going on to rehabilitation. Now, I would never promise to save a life, but I believe I am in a position where I can help people one way or another, irrespective of the outcome. Even when I'm counseling families in end-of-life situations, I can help them go through the process. Also, if you can clarify, please, what do you mean by blood pressure meds have been staying relatively low at around 3 and the highest was 8? I am unclear what you mean by this, but I'm sure you're talking about noradrenaline or norepinephrine or adrenaline or epinephrine being given for a low blood pressure. But if you can please clarify, that would be great. I'm wishing you and your family all the best for now, and I'll talk to you soon. So, how can you become the best advocate for your critically ill loved one make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section, where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype over the phone or via email by clicking on the tab on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.